Have you ever wondered who decides if a new, life-saving but super expensive drug actually makes it to your local hospital? Well, it's not a simple yes or no. There's this powerful financial tool at the heart of these huge decisions, and today we're going to untangle exactly how it works.
Okay, so picture this scenario. A brand new breakthrough drug gets developed. It works better than anything else out there, but man, it comes with a staggering price tag. So how does a healthcare system, an insurer, a hospital, or even a whole government, figure out if they can actually afford to provide it?
You see, this isn't just some philosophical debate. It's a very practical financial problem. And these decisions, they aren't just made on a whim. There's a formal, structured process they use to figure out the bottom line. And that tool, it's called Budget Impact Analysis, or BIA for short. The easiest way to think about it is like a financial forecast, right? But instead of predicting stock prices, it's predicting the financial health of an entire healthcare system.
At its core, BIA is really all about the money. It's a cold, hard look at the numbers to answer one very simple question. If we say yes to this new drug or this new treatment, what is it actually going to do to our budget?
The process itself is incredibly logical when you break it down. First, you got to figure out who needs the treatment. Then, you look at what you're already doing and what you're already spending. You make an educated guess on how many people will actually use the new thing, what it costs, and then you just do the math to see the difference.
Okay, so theory is great and all, but let's make this real. We're going to walk through a simplified BIA for a new drug for chronic pain, and we're going to use numbers pulled right from industry training materials.
So here's our scenario. We have a population of 50,000 patients. Right now, their treatment costs about $2,500 per year. The new, much more effective drug, it costs double that at $5,000 a year.
All right, let's start with the baseline. What's the cost of doing nothing new? Well, with 50,000 patients at $2,500 each, the system is currently spending $125 million a year. That's our starting point.
Now, let's look at the new drug. If we assume for a moment that every single patient switches over, that cost per patient doubles. And, well, so does the total, which skyrockets to $250 million.
And the difference between those two numbers? That is the whole point. That's the net budget impact. It's an increase, an additional $125 million. That's the new money the system would somehow have to find to cover this new treatment.
And seeing the numbers side by side like this, wow, it makes the financial leap crystal clear, doesn't it? The analysis shows the new drug would literally double the annual budget for this one condition.
But here's the crucial part. A big number like this isn't necessarily a stop sign. A BIA is a planning tool. It tells the decision makers, look, if you want this awesome innovation, you need to find $125 million. It starts the conversation about, say, negotiating drug prices or reallocating resources, or maybe phasing in a treatment over time.
So we've seen the math. Pretty straightforward, right? Now let's dive into how this simple calculation ripples out to affect real-world healthcare policies and, at the end of the day, people's lives.
You see, BIA is a cornerstone of some of the biggest decisions in healthcare. It helps decide which new technologies get approved, how drugs are priced, what treatments an insurance plan will cover in its formulary, that's just their official list of covered drugs, and it even helps shape national healthcare policy.
Now, it's really easy to see this as just a tool for these massive, faceless organizations, but its principles can actually be applied in a much more targeted and, frankly, human-centric way.
This quote here is so powerful because it totally reframes the BIA. It suggests that this financial tool, well, it can actually be used as an instrument for social good and for health equity. Okay, check out this case study from a rural caste-segregated community in India. Researchers use these exact same economic principles to ask a really important question. Why do lower caste communities have such poor access to medicine? The analysis didn't just highlight the problem, it actually pointed to cost-effective solutions. And this led to things like targeted subsidies and new community health centers, which prove that a budget tool can be used to solve really deep-seated social problems.
So what's next for all this? Well, this tool, just like medicine itself, is constantly evolving. But you know what? It's always going to be part of a very, very delicate balancing act.
BI is without a doubt incredibly powerful for its financial clarity. But it's got limitations. For one, a BI is only as good as the data you feed it, and it can be really hard to get accurate numbers. And maybe most importantly, it doesn't measure things like a caregiver's ability to go back to work or patient's quality of life. It's laser-focused on the direct cost to the payer, and that's it.
The future of BIA is really all about making it better and more reliable. This means we're going to see it pulling in real-world data from our health records,
not just from clinical trials. It means using AI to build way more accurate predictive models. And it means pushing for global standards so that every single analysis is transparent and trustworthy.
Which leaves us with this final thought, doesn't it? A budget impact analysis isn't the final answer, but it's an absolutely critical tool because it lays the financial reality bare. It forces all of us to confront the central tension in modern healthcare, that incredible price of innovation versus the fundamental promise we have to provide care. How we continue to strike that balance? Well, that's going to define the future of medicine for every single one of us.